In the last week, the number of nursing home deaths reported took a dramatic jump in our area, and now there are many questioning why these fatalities are just coming to light. Joining me now is Richard Mollot. He's the executive director of the Long-Term Care Community Coalition. So good morning to you, sir. Thank you for joining us this morning. And I want to get right to it because all of these new deaths are being reported. And my big question is, why are we just learning about them now?
Well, unfortunately, the reporting has not been mandated by the federal government, and so it's been left up to the states to report or require reporting to the extent that they see fit. And the states have done a varying job on that as well. So it really comes down to the nursing homes. The nursing homes, some have been very forthright about reporting both the deaths and the rates of infection among both residents and staff, while others, many of them, in fact, have not. So we've been pushing for greater transparency on that.
Yeah, I mean, you're a part of a watchdog group, right? So this is exactly what you look out for. Do you believe that they intentionally did not report the numbers to protect themselves?
I think, I can't obviously speak for nursing homes, but I think what we have seen indicates that a lot of them didn't want people to know the extent to which the virus is in the facility, the extent to which people are dying. It's frankly, may not be seen as good for business.
You know, from early on, health officials warned that the senior community would be the most vulnerable, right? We knew this from the get-go. So why do you think they didn't take proper precautions, states individually, to protect nursing homes in particular, making sure they had the proper equipment from jump? What are you hearing?
Well, I think that the variations in what we needed for equipment, that really evolved, I would say, over time. That, we didn't realize how important PPE was at first, in February or early March. What we did know, however, was that this virus spread through, that it was an infection, that it spread through people not washing their hands, it spread through people breathing on other people, et cetera. And yes, unfortunately, and I think deeply regrettably, change was not made. Things were not put into effect at the time that could have been, and it's not too late to do that. We could still expect more of our nursing homes and our state and federal government to ensure that that's in place. But from our perspective, this is really, still basically a failure to wash hands, a failure to undertake really basic hygiene and sanitary practices. And unfortunately, we're seeing in the federal reports that are coming out now of inspections during COVID-19 that 36% of facilities that have been inspected are still not undertaking basic appropriate hand washing techniques. And I think that's at least as important, frankly, as having the PPE.
Yeah, so that brings me to this question then, so whose job is it to actually oversee a nursing home facility, right? Some are private run, some are state run. So is it a multi-agency approach to making sure that those precautions are being taken? And is there a fine or a violation if they don't?
Yeah. They're supposed to be. So the all nursing homes that are certified, licensed under Medicare or Medicaid, they have to provide the same level of services to everyone in their facility, no matter who pays for their care. And that's under the federal government. And the Federal Centers for Medicare and Medicaid Services, it's a presidential appointee. They are responsible for paying for nursing home care, and taxpayers pay for about 75, 80% or more of typical nursing home care. That they are responsible for ensuring that residents are safe. And they contract with the state agencies. So, for instance, in New York and New Jersey, it's the State Department of Health. It usually is State Department of Health or Department of Public Health. Those agencies are responsible for ensuring that residents are safe, treated with dignity, have appropriate services, care, and safety 24 hours a day, 7 days a week, 52 weeks out of the year. So when that doesn't happen, it indicates to us, and I believe to the public, that there are failures going on in terms of safeguarding residents.
We saw those failures. I think we saw those failures play out. We had a mother on our air just a few weeks ago talking about how she can't even get information about her mother who's in one of these facilities. On the flip side of all of this, I think we'll see a lot of changes, not only nationwide, but specifically within nursing homes. Mr. Mollot, thank you so much for your time this morning and waking up with us and talking to us about this.
Thanks for having me.
Stay safe to you.
Sure.